Before we were with Premier, we had the 0844 system in place, which was very unpopular with patients. When I came into post, one of my main priorities was to get that removed.
We had an 0844 number. The patients didn't like it at all. And that was the decision made that we really needed to get away from that because of the government recommendations and patient feedback.
Effective communication and telephony is extremely important for modern GP surgeries and practices of all sizes. But it's not always easy to identify the right solution. We've now helped surgeries identify the right communication systems for over 10 years. We have an extensive range of telephone systems which will improve the efficiency of any GP surgery. All needs are catered for with comprehensive and cost-effective solutions. We begin by examining the processes of your practice, the existing setup and most importantly the needs of your patients.
I looked at several different telephone suppliers, different companies, had meetings with about 4 initially. With the existing supplier, we looked at them to see what they could do for us as well. Premier came out on top for me for a variety of reasons. Cost was one. They had history. I was able to talk to other surgeries who had made the change with them, which was very, very reassuring because it's a big thing, both financial and time, to be able to change your phone system.
I met with 3 companies. They each came out and gave me kind of their sales pitch, but it was really Premier that seemed to understand exactly what we wanted as a business.
Communication today takes place through a variety of different media: speech, messaging, email and even text-based chat. With Panasonic solutions, all of these technologies are managed centrally in just one system. With presence information that is updated on an ongoing basis, you always know when and how to best reach a contact. And by bringing main communication channels together in a single integrated system, time savings and increased productivity can be achieved.
It was amazing how much more we could do with the new system that we didn't have the option with the old system. We spent some time going through what we had, what we could do, what we wanted.
I liked what I saw with the Premier system. It offered a lot of flexibility. We're a 2-sited practice and we have a fairly complicated setup, and Premier was able to match our needs, what we needed.
It can be a daunting prospect to upgrade or modify an existing telephone system or network, but with our comprehensive end-to-end solutions, we're able to provide installations seamlessly.
On the day of the switchover, it really was, oh, did I miss it? It happened literally. We went out on the old system at the beginning of lunchtime, came back on with the new one. They were in and out of all the rooms, doing exactly what they said. It was seamless, absolutely perfect.
There was a worry that changing the equipment would disrupt the day-to-day working of the practice, but actually it was done in an extremely good way, and the chaps that came to do it were fab. They didn't disrupt us at all. They were very discreet with everything that they did, and actually the workings of the training on the new equipment was brilliant too.
The new phone system has really helped with the patient access. They don't feel that they're being penalised because we have an 084 number. It's included in their free minutes, they're free from landlines. I get very, very few complaints. I used to spend so much time dealing with patients complaining about the 084 number and not being able to get through. Now I don't. It's been a joy not to have to speak to patients complaining.